Hi everyone, welcome to Fitness Friday by Rose Walk. And this month being the month of Women's Day, where we are all celebrating Women's Month, being the month of March, we thought that we are going to throw some light on well being for women during the perimenopausal stage. Now, the perimenopausal stage remains a very important transition for women when they're about to enter the menopause, which is, of course, when the fertility period ends. And the cycle stops, and women go through so many changes in their body because there are so many hormonal changes happening. So, how can a woman during her perimenopausal stage take care of her health, and how can she improve her overall well being to help her body to cope up through the changes? So, that's what I'll be discussing today with all of you. So, first, I would like to quickly mention what are the common changes that are seen during the perimenopausal stage. So these days, considering late 30s, early 40s being the perimenopausal stage, you will see a lot of women actually experiencing early menopause. And the commonly seen changes that happens in the body could be change in the sleep pattern, could be change in metabolism, which makes them gain some weight, change in the urinary pattern. So a lot of women also tend to experience some leaking of urine on coughing or sneezing, or the capability to hold urine reduces. So they see that the bladder muscles start becoming weak. Irregular cycle can happen. Some can experience heavy bleeding, while some can experience reduced bleeding as compared to the regular pattern that they have. Also, there could be a change in appetite, change in bone health, could be some hair loss, skin changes happening, and a lot of women tend to gain weight during this period. Some also experience pain in joints, and of course, there's also some postural changes that could be seen if women are not taking care of their overall health. Now, these are the commonly seen changes during the perimenopausal phase. Also, could be seen along with some hot flushes that happen, some change in moods, which leads to a lot of mood swings, irritability, and hence it kind of makes the perimenopausal phase a little difficult for women to deal with. Now, what are the things that women can do during the perimenopausal stage to make the transition smooth and easy as they enter their menopause? So now I'm going to cover the main aspects of well-being for women at 40. Very important because yes, 40 is like the new 30s now, because if you take care of your health during the 40s, it becomes as easy as your 30s. So what are the things that you can do? I'm going to start off with the first part of the well-being. So my first part is the mind. So how can you take care of the well-being of the mind? Now, considering the COVID times, we have seen a lot of women experiencing mental health issues and difficulty with dealing with changes, in the situation. So that's why the adaptation has to be good. And similarly with the transition in a woman's life, whether it's going from adolescence to her adulthood, from her pregnancy to the postpartum period, similarly from the perimenopausal phase to her menopause, how can we make the transition easy? So how to take care of the mind during this phase? So I'm going to cover main topics that will help you to take care of the mental well-being. Relaxation techniques, you have to stay relaxed, and how to stay relaxed is what you have to practice. So start practicing some relaxation techniques on regular basis. So do some breathing exercises, do some relaxation techniques so that the mind knows how to go into relaxed state whenever you get stressed out. Number two is regular breathing exercises. Now, a lot of times, we do tend to focus a lot on our physical fitness, but how often do we actually sit down just to focus on the breathing exercises? Thanks to the COVID times, people have realized how important is it for the lungs to have good capacity. So to improve your lung capacity as well and to be able to fight the COVID, you need to have good breathing capacity. So do lots of breathing exercises, sit down for about 10 to 15 minutes every day where you're just focusing on the breathing part. Could be deep breathing, superficial breathing, coastal breathing. There are different types of breathing exercises. Make sure that you try to spend 10 to 15 minutes every day just to do the breathing exercises. Third is stability. Now, how to gain the stability of the mind? with our inner self. A lot of times we have so many questions going on in the mind. Could be conscious, could be subconscious mind. Now, how do we ensure that we reach that stability of our mind where we are able to take control of the mind so that the mind controls the body? So ensure that you try to gain that stability in your mind. So if you have any inner conflicts disturbing you, if you have any issues that are going on in your life, which could be relationship issues, which could be related to your stress, to your work life. So if you have any work life issues, your personal life issues, try to find solutions, because the more you try to suppress it inside you, it just leads on to a lot of subconscious stress in the mind, and hence it disturbs the stability, the equilibrium of the mind. Then regain the confidence. So as you enter your 40s, what happens is the body goes through a lot of changes, the face goes through a lot of changes, and a lot of times many women also tend to lose their self-confidence. So if that is the case, try to regain the self-confidence, which will help you to boost your inner self in a healthy, positive way, so that that helps you to have a positive mind. It could be in the form of a wardrobe change. So you could probably go for a new wardrobe, fill more bright colors into your wardrobe, more bright colors into your life. If the body shape has changed, the body size has changed, of course you can go in for one size bigger clothing, but regain the confidence in yourself so that whatever you wear, you should always feel the best. So these are the ways in which you can take care of the mind during the perimenopausal stage. Now I'm going to move on to the second part of my well-being tip, which is going to be the second part, which a lot of women tend to focus a lot on, is the body. So how can you take care of the well-being of the body? That's where the physical fitness plays a lot of role. So, the saying goes on that we are what we eat. So we should ensure that we eat right. You should avoid any deficiencies in the body. Now, this is the time where a lot of women tend to develop calcium deficiency. And if they're not eating right, or there's no sunlight exposure, could also be deficiency of vitamin D, which affects the bone health. Now, my most important concern for perimenopausal women would be the bone health. How do we ensure that we take care of the bone health so that when you enter your menopause, you should try to keep yourself away from bone issues like osteoporosis, osteoarthritis, postural instability? And how do we ensure that? So that's where we have to focus a lot on taking care of our bones. So how to ensure well-being? You need to improve your physical fitness. So my suggestion is, you could enroll yourself in some sort of exercise activity. Keeping COVID times in mind, you can do a lot of home exercises. So you could learn some home exercises, the safe ones from us, of course. And also if you have any fitness expert, and do regular exercising at home. So I recommend at least 30 to 40 minutes every day, which includes a good warm up and cool down, because remember, we don't want any muscular injuries happening in the body, because that's the time when the body is also prone to developing a lot of ligament injuries, muscle injuries, because the body is not used to heavy kind of exercises. And if you suddenly start doing it, the body kind of shows some repercussions, which could also be negative or positive. So good warm up, good cool down, do your stretches, improve the flexibility of the muscles to prevent injuries, and lots strengthening. Because a lot of women tend to gain some belly fat. They gain the fat around the belly area as the metabolism slows down, and we need to have good core strength, because if your core has good strength, it also improves the stability of the body. So how do we do that? You engage in lots of core strengthening exercises. Could be using the Swiss ball, could be in the form of Pilates, could be in the form of yoga, and other forms of pelvic exercises. Now, if you ask me, my favorite ones are the belly dancing exercises. So all women at the perimenopausal stage, get yourself on your toes to do some belly dancing exercises, because it also uses the pelvic area that has all your reproductive organs, and that will help you to strengthen your core, your pelvic muscles, and plus you will boost some happy hormones as you enjoy the belly dancing workouts as well. Now, other than that, the bone health. How do we improve the bone health? So for that, do some weight training. So apart from all these other exercises that I mentioned, add some weight training exercises because that will improve your bone health. We need to improve the bone density. So for that, weights are important. So some dumbbell workouts, some ankle weight exercises, could be some TheraBand resistance exercises, which will help you to improve your bone health, will strengthen your ligaments and muscles, and will help in preventing injuries as well. Also, when you tend to develop issues like arthritis, so it will also help you in managing the joint mobility, because when you do these kind of exercises, it strengthens the muscles and takes the load off the joint so that your joint pains reduce. So in case you also have a family history of osteoarthritis and there is a higher tendency of you developing it, at least your muscles and ligaments will become stronger, hence reducing the load on your joints and reducing the chances of you having joint pains. Now, coming to the heart health, the cardiac health. As the perimenopausal stage goes on, a lot of women also seem to develop issues of the heart. Now, frankly speaking about it, I totally feel that cardiac health in women is a very, very under talked about subject in the society. When it comes to talking about cardiac health, a lot of attention is given to the men, but why not the women? There are a lot of women also who experience cardiac health issues and also go through, have deaths due to cardiac arrest. So I feel that women need to take care of their heart as much as men need to take care of their heart. So engage in some cardiac form of exercises, could be running, jogging, cycling, treadmill, swimming if you love swimming as well, dancing. So do engage in some cardiac form of exercises to take care of your heart health. That is very important. Now, apart from that, talking about some nutritional tips. So increase the hydration levels, drink more and more water more often. Also, add lots of omega-rich foods to your diet. So nuts, flax seeds, sunflower seeds, fish, avocado. These are all rich in omega fatty acids, which is required to take care of your heart and also takes care of your joints. So especially for perimenopausal women, omega fatty acids are very, very helpful in preventing a lot of joint-related issues, and it also keeps the metabolism high. You could also engage in having some herbal teas, which helps in speeding up your metabolism. Avoid too much caffeine because it can aggravate your hot flushes and can also lead to excessive chances of palpitations. And avoid alcohol, avoid smoking, because we need to fix the lifestyle to take care of our health post 40. So if you have, a lifestyle in which you're drinking a lot of alcohol or smoking, then try to reduce that. Plus, increase your protein intake, have lots of proteins, have lots of veggies. Try to have smaller portions more frequently to boost the metabolism, and try to focus on controlling your weight, because the moment you hit menopause, a lot of women experience a sudden weight gain. So that's why you need to be a little careful about what you eat. So try to keep a watch on your weight. Avoid sudden weight gain. The moment you feel that you've gained a couple of kilos, try to focus on losing it, because that is the biggest challenge when you enter your menopause, that reducing weight becomes very, very difficult. So the transition phase, the perimenopausal stage, if you can take care of your weight at that time, it helps you to stay in the right BMI range when you cross your 40s and 50s. So please give extra attention to your weight. If you're already overweight, start losing weight. Now I'm going to come on to the of course, I forgot to mention calcium. So calcium intake is also very, very important. So you can speak to your gynecologist in case she would like to prescribe some calcium supplements to you. You can add that to your diet, because you need to have good calcium level in the body to take care of the bone health along with good bone density. So also take natural food items that are rich in calcium. So you can go for milk products. If you have any lactose intolerance or milk allergy, you can also go in for almonds milk or soy milk, but ensure that you take care of the calcium intake in your diet. Now, coming on to the third aspect of the well-being, I am now going to talk about this. So this is what will help you to keep a balance between your mind and your body. So how do you ensure to take care of the well-being of the soul? We are what we are. It is our inner soul. How well can we connect with our soul is how we can achieve nirvana. So how to get that contentment in our life? We need to take care of the well-being of our soul. So what are the things that will help you to take care of your soul? So first of all, practice mindfulness. Whether you're eating, whether you're talking, whether you're reading, whether you're exercising, whatever you do, practice mindfulness in it. If you're spending time with your children, practice mindfulness in it. If you're spending time with your partner, practice mindfulness in it. So don't forget to add mindfulness into your life. You will see a lovely transition in your life the moment you start practicing mindfulness. It will boost more happy hormones and you'll achieve more contentment in your life. Now, the next is travel. Traveling is very, very soulful. But how often do we travel? Sometimes we are so busy in our lives that we forget to travel. And now, because of the COVID times, definitely traveling has reduced. So, not necessary that it has to be a long distance travel. Even a small break, like just going and spending a weekend getaway with family, could help in boosting those happy hormones. So, try to travel more often. Visit new places, meet new people. That also helps in stimulating happy hormones. Then the feel good factor. When was the last time you felt good about yourself? Now, like I mentioned, that the body goes through a lot of changes, the skin and hair goes through a lot of changes, and sometimes you don't fit into the old clothes when you're going through the menopausal phase. And what happens is you start feeling bad about yourself. Then you'll think that, oh my God, I don't fit into my old pair of jeans. What am I going to wear? Where am I going to go? People will say I've gained weight. So feel good about yourself, about the whole transition. So that's why I mentioned that you can go for a wardrobe makeover, try to lose weight, and feel good about yourself. So the more happy you feel from within, it will always reflect on your face. So you need your soul to feel happy for you to get comfortable with the changes happening in the body. Then friends at 40, try to make more friends who are your age, because that also helps you to create a community support for yourself, because all of you are going through the same changes, and it helps you to kind of communicate with each other well. So you can make new friends at 40, you can talk to each other about what are the changes that you feel, what they feel, and that just helps you to get through the transition phase in an easier manner. Therapies. There are a lot of therapeutic activities that we can do on a regular basis that helps us to take care of our souls, because the inner happiness is what reflects on the face and the body. So small things like cooking, reading books, listening to music, dancing, gardening. These are therapeutic activities, going for simple spas and massages, aromatherapy. These are the ways in which you can boost happy hormones from within and make your soul happy. And also, not to forget, having soulful food. So sometimes you can have a cheat day and you can have something that makes you feel very, very happy. So don't forget to have your cheat days as well. So yes, follow a strict routine to lose weight, but don't forget to have your cheat days as well. And last but not the least, being a little spiritual. So you could spend some time on doing some meditation, bringing out the spirituality side of yours, rediscovering your inner self, rediscovering your spiritual side. I'm not saying about being religious, but about being spiritual. So you could read some books on spirituality if you want. You could, go for workshops that kind of practices positive approach in life and helps us to just discover a lot of spirituality around us. It just helps us to kind of, rediscover ourselves from within, rediscover our souls. And simple things like enchanting mantras, listening to mantras, or listening to spiritual people, listening to spiritual talks can also help us to recreate a lot of positivity around us and within us. So let's achieve that right kind of balance within ourselves and the universe around us, so that when we attain the right equilibrium, it just helps us to get through the transitional phase in a easier manner. So on that note, I would like to advise all the women during the perimenopausal stage. If you know another woman who's of your age group, help her, become her companion, and you could be the best buddies. You could be the perimenopausal buddies to make this whole transition phase easy, not just for yourself, but even for her. Could be your sister, could be your sister-in-law, could be a friend, could be a neighbor, could be a colleague at work. Build up that rapport with women around you at your age and hold hands, support each other to make the perimenopausal transition as early and smooth and as easy as possible. Not early, definitely not early. So I'll be happy to answer questions now. And being the month of March, which is the month where women get to gain the maximum attention from where I wish all the women watching us right now to take care of your well-being, to take care of your health, because health is wealth. We all know that. So you just need to ensure that every transition that comes in your life, it should be easy and smooth for you. And perimenopausal is definitely that transition where you enter menopause in your life and you see a lot of changes happening in the body, a lot of hormonal changes going on. So how can you make it smooth and easy for yourself? It's by you taking care of your own health. It's by you taking care of your own well-being. So please follow all the tips that I mentioned, and I would also be happy to help you at Rosewalk Hospital. So in case you would like to have a consultation, I'll be happy to help you at Rosewalk. You can book a consultation with me. Offline, online, doesn't matter. Considering COVID times, even if you want to have an online consultation, we'll be happy to do that at Rosewalk. So stay fit, stay healthy, keep exercising, stay safe. We have a question here. My 51-year-old mother has hypertension and is pre-diabetic. She has fibroids. She has back pain for 6 months, which started radiating to her anterior abdomen and the inner thighs. What's wrong? Okay. Now, that seems to be quite a lot of health issues. Definitely pre-diabetes related to the lifestyle, then fibroids related to the gynecological health, and back pain related to the orthopedic health. So in that case, a team approach would be able to help your mother. So please consult the right team of doctors so that everyone can help your mother in every aspect, because there are 3 aspects that are involved here. So I would suggest that you could consult a physician to guide you properly for that manner, so that she gets the right treatment at the right time. And yes, please do not delay it. Take her out to see a doctor so that she can get the right kind of support at the right time to make the period of her 50s comfortable and smooth for her. Okay, we have one more question. My endometrial thickness is 14 mm on the second day of my period. Should I be worried? I have been referred to gynecologist and waiting. Any idea what will they suggest? Okay, so Ashima, I'm here to help you for the well-being, and this seems to be a gynecological issue. So yes, you need to see a gynecologist for this, and we have a lot of gynecologists available at Rosewalk, being a hospital for women. So do feel free to drop in, and we would be you as a team. I can help you for the wellness, and the gynecologist will be able to help you for the gynae health. So do drop into Rosewalk. That's what I'll say. Okay, we have one more question here. What are the most effective weight loss strategies at midlife or during perimenopause? Is diet or exercise more important? So that's a good question, and that comes as a well-being question. Superb. So Mrs. Juneja, so there are different strategies for weight loss. Some could be helpful in some people, and you can also see that if you replicate the same strategy for yourself, not necessary that your body will respond. So every body is different, every woman is different, and sometimes even if we start off with a weight loss strategy, we do reach a period where the weight loss becomes constant and you stop seeing any response in the body. So the weight loss strategies always have to keep changing. So how can you keep changing the strategies? There are lots of weight loss strategies. Diet and exercise go hand in hand. They are equally important. So if you follow a strict diet and you don't exercise, you lose kilos, but then the skin becomes saggy. And if you exercise a lot and you eat a lot, then what happens is the exercise will help you stay fit, but you will not lose weight. So you need the right kind of diet with the right kind of exercise. Both are equally important, and more than that, you need discipline in your life. So please follow a disciplined life. Be sure that you're following the diet that you have been advised, you're following the exercise routine that you've been advised, and you don't let yourself lose by breaking the pattern. So stay disciplined, follow the exercise and the diet plan advised for you. Please do not copy anybody, because everybody is different. So you don't have to just copy what someone else is doing. Get yourself checked. Let your medical investigations be done so that we can understand your body, and in that way we'll be able to help you out in the right manner, so that we know that what would be the best strategy for your body. So thank you so much everybody for joining in for today's session. Hope you all enjoyed the session and hope you all benefit from today's session. So don't forget to like and share our video so that you are able to help us to help more women to stay fit and healthy at the perimenopausal stage. So thank you everyone. Have a great day. Stay fit, stay healthy, stay safe. Bye-bye. Take care.